braces treatment-wise, there's two different types. The traditional braces versus the self-ligating braces. So with traditional braces, there's the metal type, whereas there's also the ceramic type, where essentially you still have an arch wire and you still have a little module over the tooth, okay? But the bracket itself is tooth color, so it's a little bit more aesthetic looking. All right, so these ones are the self-ligating braces. Okay, there's a door that closes over the little bracket right here. So then the wires always shut down in this underneath this door. So there's less friction with this one. Okay, so this one also a self-ligating bracket, okay, but this is a ceramic type, so it looks more aesthetic looking. Second generation, the self-ligating ones, there's less friction and a little bit less pain as compared to the first generation. Well, the first generation, the pro to that is you can change the colors of the modules. So if it's Christmas time, you can choose red and green if you'd like to. So there are basically three main components. Okay, there's the bracket, there's the arch wire that goes across it, and then a little elastic module, like a little rubber band that they use to hold the wire onto the bracket. On the day of the braces appointment, we'll need to polish your teeth, make them extra clean so that the braces that we put onto the teeth won't fall out. Okay, so to make sure that everything is all nice and clean. Okay. Afterwards, we use a little bit of a chemical that we'll place onto the tooth. Okay, we wash and dry it off, put a little bit of bond material on, and then on the bracket itself, we'll put a little bit of glue on, stick it right onto the tooth. Use a little blue light, shine it, and set the glue, okay? After you finish putting on all the brackets on your teeth, we'll have a little arch wire that goes across, and a little module to hold the wire onto the bracket, okay? At the ends where the wire sometimes pokes out, we'll need to cut it a bit short, cinch it back a little bit, and make sure that it won't poke your cheeks. If it does hurt you, just feel free to come in, we'll cut it off a little bit, or give you a little bit of ortho wax to put onto your brackets or any wires that do poke you. So a lot of patients, they think that we're tightening your teeth. Technically, we're not tightening your teeth. We're having a look inside, removing your modules one by one first, maybe removing your arch wire, and then checking how your teeth have been progressing, whether we're applying enough pressure on your tooth or whether we need to change the bracket a little bit. But basically what happens is we put in a new wire or maybe the same wire, put a little module back on top, okay, cut the ends off, okay, and that's pretty much it. So I hope I've cleared up all the questions that you have about metal braces. So a lot of patients, they worry and say, oh, I don't want to come in, okay, but traditional braces actually is not so bad. It's not as painful as you think that it is. Appointments are pretty short, and if you ever need some advice, feel free to come in, drop by, and we'll have a quick chat with you about whether braces is right enough for you.